The average cost of 1 year in a nursing home now exceeds $70,000, but the average net worth of a 65-year-old is only $110,000. This means you could blow through everything you have, including your home, in 18 months or less. Maybe you're only in your 40s and you hardly think about those golden years. That's trouble. The estimated average cost for 1 year in a nursing home in 2030 will be $190,000. Of course, when you're in your 40s and 50s and 60s, it's difficult to predict how much care you're going to need down the line. But you shouldn't let that stop you from making some financial plans. Currently, only 7% of American seniors have enough saved to cover even 1 year of nursing home care. Thus, 70% of single people and 50% of married couples who require long-term care become destitute. Now, many of you might be saying to yourselves, but I don't want to go to a nursing home. And you're not alone there. No one wants to think of themselves as incapable of providing their own care or consider having somebody else run their lives. But the reality is that 60% of current 65-year-olds will require some kind of long-term care in their lifetime, either at home or in an assisted living facility, or for some in a nursing home. That's why so many people are looking with renewed interest at long-term care insurance, a safety net concept for seniors that's been around for quite some time, but now suddenly it's getting more interest. What is long-term care exactly? Well, it's different from what most Americans think of as health care, and it usually isn't covered by health insurance policies, HMO plans, or Medicare supplemental policies. Long-term care can range from basic help with tasks around the house to more essential assistance with activities of daily living like bathing, eating, or getting dressed. Many think that they'll be able to fall back on family members or friends if they get in trouble, and age in place at home. Well, this might work for some if you're lucky and aren't disabled or markedly ill, if you don't have Alzheimer's or dementia, and if your family is supportive. But looking ahead, this safety net is likely to weaken. With the size of the American family getting smaller, there are fewer adult children to do the caregiving. Also, children live farther away from their parents than they used to a generation ago. And lastly, many more women are part of the workforce now. In addition to family and friends, Medicaid has traditionally been another fallback for long-term care. Through a variety of legal loopholes, a failing senior or his or her family could spend down their assets, basically causing themselves to go broke on paper, and then qualify for government payouts for their nursing home care. But as our society has aged and costs have risen, Medicaid, a partnership between the state and federal governments, is feeling the strain. Medicaid expenditures now account for about 25% of the average state budget, and in response, the Deficit Reduction Act of 2005 modified the rules, making it somewhat more difficult, though not impossible, to qualify for Medicaid coverage for nursing home. So unless you can afford to pay $70,000 a year now, or an estimated $190,000 by the year 2030, you need to think a little bit about long-term care insurance. The policies are increasingly common and flexible, but of course, they're not for free. It can cost a 55-year-old $5,000 per year for a plan that provides $200 per day for a lifetime, with an annual 5% inflation adjustment and an initial 60-day waiting period. That probably puts this type of insurance out of reach for a good number of people. But here are a few things you can do to bring down the cost. Limit the benefit period. Only 8% of seniors require coverage for more than 5 years. If you go with 5 years of coverage versus lifetime, you'll save $2,000 per year. If you're married, consider a shared policy. Plans now allow couples to buy 2 policies almost for the cost of 1, and you can share the years of coverage. Don't be penny-wise and dollar-foolish on the key benefits. Since costs can be unexpectedly enormous, be careful about those waiting periods. If you're in your 50s and healthy, look for an individual policy versus a group policy. Otherwise, You'll be factoring in the actuarial cost of individuals who are less well than you are. And compare prices for a few insurers, including name brands like Genworth Financial, John Hancock, Mass Mutual, MetLife, New York Life, and Prudential. The bottom line, you're not going to be young forever. Set aside some time and money to ensure you'll have the care you need when the time comes. For Health Commentary, I'm Mike McGee.